I'm Joe Camp. I've been practicing endodontics in North Carolina for over 40 years and teaching part-time during my entire career. Radiographs are an important part of the diagnostic process, but there are several factors about x-rays of which you need to be aware. You need to understand that when you take an x-ray, the beam is shot facial to lingual, but the film is read mesial to distal. Because all human permanent teeth except the maxillary central and lateral incisor are 2 to 3 times as wide faciolingually, most of the variations in anatomy occur in that plane and are not clearly visible on the film. If the need arises, a cone beam can show you anatomy you can't see on a conventional film. Let's take a moment to look at what it takes to make radiographs that will help you with your diagnosis. This radiograph illustrates an important point. You notice that the apices of this tooth are not on the film. If you are going into the pulp, you need to have an image of the entire tooth. So we take another image, and here you see a massive lesion on the distal of this tooth and around the apex of the tooth, and actually this case has a neoplasm which we picked up in this film, and this patient actually expired within 6 months after this film was made. So it's very important to have the entire tooth on the film. Here is a Bitewing x-ray which shows clearly the cavity in this lower molar, which is going to expose the pulp. However, this is not adequate to do endodontic treatment to go in and expose the pulp on this tooth. You must have a clear image of the roots to see the root development and what's around the end. So here is another film of that same tooth, and you see that the apices of this tooth are wide open and not formed. Therefore, conventional endodontics on this tooth would be impossible to obtain. Fortunately for this patient, we were able to do vital therapy of pulpotomy, and here you see the tooth 2 years after the treatment and the closure of the roots. These simple tips should help you to get better images that will put you on the right diagnostic track. I'm Joe Camp for Chair Time.